Hi, welcome to Health Boss Talks. We have a great show for you today. We're going to be talking about diabetes, and it's important because there are millions in our community who suffers from this disease called diabetes. We want to welcome you back again with us and getting the message out that we want to be healthy at any age. Our guest today is Miss Ethelyn Gibson. She's an RN, and she's also representing the American Diabetes Association. Welcome.
I'm glad to be here.
Good. I know you are a volunteer with the American Diabetes Association, and you're also a registered nurse.
Yeah.
Could you tell us a little bit more about yourself?
Yes, I've been a registered nurse for almost 35 years.
Wow.
And in those 35 years, a lot of that time has been spent focusing on community education surrounding chronic disease. I've been prepared for that. I'm also a clinical nurse specialist, which is an advanced practice nurse with a master's degree in adult health with a concentration on diabetes. And I've volunteered for over 20 years with American Diabetes Association and also American Heart Association.
Wow, you've got a lot of experience behind your belt. Now, where did you go to school? Are you from our area?
No, I'm originally from Cleveland, Ohio, and attended Ursuline College there for my undergraduate degree, and then actually joined the military. So I'm a U.S. Army veteran. Oh. And then after serving time in the U.S. Army, then I went to school for my master's degree at the Medical College of Georgia in Augusta, Georgia.
Wow, well, thank you first for your service. Let me ask you this. How many Americans suffer from diabetes?
Well, the numbers are staggering. Think of 1 million, but multiply it times 29. So 29.1 million are diagnosed with diabetes, but 8 million of those have no idea that they have diabetes.
Wow. Now, statistically speaking, how many people of color suffer from diabetes? Because I read all the time that we are leading the pack.
That we're leading the pack? Well, yes, we are leading the pack. So we talked about the 29.1 million who have diabetes. Out of that, 2.2 million African Americans have diabetes.
Wow, and how many right here in the Tidewater area?
In the Tidewater area, we actually have over 500,000 citizens who have diabetes. And if we look at where the concentration of diabetes is in the state of Virginia, our three top areas, the top one is Petersburg. The one following that is Charles City County. And then after that, the Norfolk area, which is right at our back door. So that's the highest concentration of diabetes in the state of Virginia.
Wow. Is there any correlation or anything to substantiate why it's so high in these areas versus other areas?
Well, we feel that because those areas do have a high concentration of migration from people who have served in the military, and then when they retire, they remain in the area. So if you look at the Petersburg area, we have a large military base there, Fort Lee. And then if you look at the Norfolk area, we have a large concentration of the Navy and all branches of the service. But again, because we are in Virginia, we are considered part of what's called the Rust Belt. And so in this area, being the Rust Belt, we do know that in the South, because of the way we like to eat and not move, that actually then pushes up the numbers no matter whether you're African American, no matter whether you're Caucasian or any other ethnic minority. Because of the way we live and don't exercise, we fall into that Rust Belt in the South.
Now, I heard you say exercise and movement several times. Mm-hmm. So I take it that more movement can decrease your symptoms and the disease itself within you.
More movement can help you all the way around. A lot of what I do with the American Diabetes Association is to try to translate in the community, how do I make sense of diabetes? Because people will go to the doctor, they will come to the emergency room, we will tell them they have high blood sugar, we will tell them what will happen if you have high blood sugar. It can lead to heart disease, which is high blood pressure. You can possibly have a heart attack. you have extra fat in your blood, and we tell them all those things, and the whole time when they're talking to the doctor or the diabetes educator, they're shaking their head, I understand, but part of my career was spent in the emergency room, and every Sunday afternoon after church, I would still see the same people every Sunday after church, and I walk into the room, and they'd say, Mrs. Gibson, and I go, so was that chicken good at the buffet? And they'd be, the buffet? I said, the buffet. So we need to learn how to translate the education that's needed for people to know how to live healthy. And that's what American Diabetes helps us do by doing a variety of community programs.
Oh, okay. For people that are out there listening and looking in, what are some of the symptoms? Sometimes people don't know they have diabetes and they continue to eat poorly and that
Correct.
type of thing.
One of the, well, there's three big symptoms. People will have frequent urination. They're going to the bathroom every hour when that hasn't been a norm for them. They're overly hungry. Now, that makes it sort of confusing because you could be hungry just because you see the food and you want to eat. And then people then start to have blurring of vision because they aren't quite sure. That's a lot of the circulating sugar that's in the body. So one thing that we try to teach people, and I teach classes at the Community Free Clinic of Newport News because we try to meet people where they are. And when I'm teaching that diabetes education class, I say to them, now, if you are gaining weight all of a sudden, and they go, well, what does that mean? Well, we as women, we'll put a dress on and we'll say, oh, I need to get a different size. Now, before you get a different size, you need to get tested for high blood sugar because sometimes it's not about the dress. The dress is trying to give you a message. And so we say that you should be having an annual physical because an annual physical will check your blood sugar to see if it is normal. And if it is abnormal, which is what we call your random blood sugar, so your random blood sugar, no matter what you've had to eat, even if you've been down on the corner and you've had 6 Krispy Kreme donuts, I tell people, I say your blood sugar still should be below 240. And if we check your blood sugar and it's above 240 randomly, that's a red flag. And so usually at that point we say you need to follow up with a physician or a nurse practitioner so that they can do more testing, and from there we can make a more definitive diagnosis once we have more information.
Oh, okay. Now you talked about testing. What's involved in the testing, because sometimes people don't go to see what's wrong with them because they think it's a long process or it's needles involved and that type of thing. What types of testing is done to determine whether you have diabetes?
Well, you know, in the community we do just basic random screening. You probably have seen a mother or an aunt or someone that has a blood sugar meter. And so at many of our churches, at our community free clinics, you can come into any of those free clinics and they will just do a simple prick of the finger and it'll put a small drop of blood on a test strip, and we can see what is your blood sugar. Is it falling below that number of 240? If it's above that and we send you to a doctor's office, a doctor will then have to draw blood from your arm so that we can then see a more definitive number. We want to see what your fasting blood sugar is, and that's the blood sugar where we tell you not to eat or drink anything for at least 8 hours. We typically like to draw your blood in the morning. Then we would like for that to be no greater than 140. Because it could have been, you know, you're having a bad day, things just aren't the way they should be. So your random gives us a little bit of information. The fasting blood sugar gives us a much more definitive number. And then after that, we also look at a number that's called the hemoglobin A1C. And we actually call that the truth test. And you might say, well, what do you mean the truth test? Many years ago, we would have people who we knew had diabetes, and we'd tell them, test your blood sugar at home. And when you come into your doctor, bring your blood sugar log with you. And so people would take their, log, and they'd have all these wonderful numbers in there. And then a week later, I see them in the emergency room. Why did you have these great numbers? Something wasn't right. They didn't want to get tapped on the hand by the doctor or the nurse practitioner. So we now have a test that's called the hemoglobin A1C. And what it does is we test your blood, and it tells us what has been your average blood sugar for 3 months. You can't fudge it. You can't make it up. It tells us, and then you can actually sit with your doctor or your mid-level provider and actually have a good conversation, a truthful conversation. Because really, we don't want to slap your hand because you have diabetes. We want to make sure your diabetes is under control so that you don't lose your sight, so that you don't lose the functioning of your kidneys and end up on a dialysis machine, so that you don't lose circulation in your feet and then you have an amputation. Or, especially for women of color that have diabetes and high blood pressure, they are more at risk for having a heart attack. So it's very important that we just want you to live healthy. And that's what I tell women when I'm out speaking at community health fairs, when I have them in diabetes education classes. It's not about that I want to tell you what you're doing wrong. I want to tell you how you can keep living and spend time with your grandchildren, have time for another birthday, go on another vacation with your girlfriends. That's what it's about for me. And that's why education is so important when you know you have a disease such as diabetes.
Okay. Sometimes I hear people tell me that they are pre-diabetic, and sometimes when they say that, I assume they think that they have a free reign to eat as much of everything that they want.
Correct.
What is the difference in being pre-diabetic and full-blown diabetes?
So pre-diabetes, remember when I told you about that number of 240? That's a random number. And so no matter what you've had to eat, that random number could be above 240. Typically, if that number is at 240, we are putting up the red flag to say, you could be falling in that category of prediabetes. Years ago, that's what we used to tell people was borderline diabetes. And we didn't do people a big favor because when we told them they were borderline, they thought that was a ticket to keep eating. In my classes, I always tell folks with diabetes and prediabetes, how many of you have children? And frequently people will raise their hand. And I say, now, when the doctor told you you were pregnant, you had a baby, right? Now, they didn't tell you that you had a little bit of pregnancy, okay? They didn't tell you you were borderline pregnant. You had a child. And if your child is even 45, you still have that child. So diabetes is pretty much the same. When we tell you you have prediabetes, it's there and it is not going anywhere. It's all in how you start to live with it. So we are now trying to get the message out in the community that prediabetes is just as devastating as type 1 or type 2 diabetes, because we have found that many women who have gestational diabetes, I don't know if you've heard of that, that's the diabetes you have while you're pregnant. And many women, when you're at your 12th week of pregnancy, they have you drink this gooky stuff, and they want to see if you're borderline. And many of us have that temporary diabetes while we're pregnant with our children. Research has found that if you are diagnosed with gestational diabetes, you are more at risk for developing type 2 diabetes once you are in your 40s. Wow. And the same thing with prediabetes. We know that there are some groups that are more at risk if we tell you you have prediabetes. Those that are African American, Asian American, Latino American, if you're 45 years or older. So we really want to make sure that, again, we're getting out the message. Physical activity. That doesn't mean we want you to run a marathon. We don't need you to run a marathon. How about just choosing one day a week that you actually maybe go out and walk with a friend? Something as simple when we talk about good nutrition. We're not saying go on a diet. Breakfast, lunch, dinner, and a bedtime snack. I told people everything that we teach you when you have diabetes is everything that your mother told you when you were in kindergarten. You never went to school without breakfast. When you got to school, you had lunch. When you came home, you had dinner. And if you were really good, you had a snack. And it was a healthy snack. Right. So activity, 3 meals a day. And then, if need be, if you're on medication, then making sure that you take that medication that you've been ordered to take. And it's no magic bullet. I mean, it's no magic bullet. And then keeping your weight at a manageable level. You don't have to get on a scale. You know when you walk down the street and you can't breathe by the time you get to the end of the street.
Hallelujah.
I mean, so you really don't have to get on a scale. You know when your body is sending you a message that you're not healthy. So if we all could just take those messages and share it with our community, which is what American Diabetes does, what the community programs do, that's how we start to get healthy and live better with diabetes or even prevent diabetes.
Well, you've given us a lot to think about. We're going to have to close here today, ladies and gentlemen, but I think Mrs. Gibson gave us a lot of information on diabetes and how it's affecting all of us. And I just want to say thank you again for being here with us. And our show is to educate and to motivate, and I'm sure your message has educated as well as motivated. Thank you.